Tonight on Let's Talk About Health, we answer the question, should you hold your pee?
Sometimes I don't have a choice, right? I mean, like, especially if you're in a bus ride, I guess I hold my pee in.
Also, the story of a young woman who practically lived in the bathroom for almost 3 months.
I suddenly found myself having to go to the restroom frequently, like every 10 to 20 minutes. I think that day alone, I went to the toilet about 50 times.
We find out what happened to her right here on Let's Talk About Health. Good evening, everyone. Now, Mike, seeing how we're so familiar with each other now on national TV, I'm going to jump straight into it. Are you guilty of holding your pee?
I guess we all are. So from time to time, I will hold my pee. I'm holding it right now, as a matter of fact.
Doing those kegels as we speak.
I'm saving it for later.
Exactly. Anyway, here to explore the topic about peeing are our guests, Siti, Kalijah, Adele, Wong, and we've got our medical expert, Dr. Ronnie Tan. Welcome on, you guys. Come on in.
All right, guys.
Hey.
Well,
what's up, guys? Welcome, welcome. You know, I'm going to put you guys in a spot just like I did with Mike earlier. So do you ladies hold your pee?
Sometimes I don't have a choice, right? I mean, like, especially if you're in a bus ride or in a train ride and you don't have a choice and you're rushing somewhere, I guess I've hold my pee in a couple of times.
I mean, I think as actors, it's part of the job. Hazard, right?
really? You guys get paid extra for holding pee?
You wish.
If I did, I think I'll be making bank.
Yeah.
So, doctor, if you have the pee in your bladder for long enough, will your bladder stretch out and get used to it and then you don't need to go as much?
Typically, it is okay to defer the need to pass urine as long as it's not causing discomfort. For example, if you're holding your bladder such that you're having pain in your lower abdomen, that's a sign that you should go. If a person continues to allow his bladder to distend, then we come to a point where he actually loses sensation that he needs to go, and the volume can actually increase in size. And of course, if you find that urine starts to come out, that will actually mean that you are having what I call overflow incontinence, which is actually leaking.
Oh, and that's not normal. That shouldn't happen.
Definitely not normal.
So we do have a jar over there, and this is for our guests. Let's grab the jar, and then each of you pour in how much you think that a typical bladder can hold.
All right, let's do this.
By the way, this is not actual pee, you know? Like,
I'm glad.
Thanks for confirming. Just letting you know. Okay. Just stop wherever you think is the maximum amount that your bladder can hold. And then I think the doctor will surprise us with his answer or let us know what it is. This color of pee, is it also normal, doctor?
Looks a little bit concentrated.
Right. Let's see, Siti, let's start with you. How many
About
milliliters?
500, because I think if I don't wake up in the middle of the night, I know that my bladder gets really full in the morning, and I think it can hold about this much.
You feel like you're peeing forever, right, in the morning
it's
sometimes.
like non-stop.
So Adele, how many milliliters do you have there?
I think about 600.
I think they're quite close. So basically, a person will want to go to the toilet when the bladder holds about 300 to up to about 500 or 600 mils.
And what is max that a bladder can hold?
Well, we have seen cases where the patients have a chronic retention of urine. They actually come in with close to 1 liter of urine in the bladder. But of course, that's really unhealthy.
What would that look like in one of these balloons, say?
Okay. Yeah, so typically...
That would be normal.
Yeah, it should be about right, about 300 mils. Because usually the bladder is actually found in the pelvis. When the bladder is not filled, the doctor will not be able to fill your bladder.
Okay.
So once you have a full bladder, it comes out. So probably that would be about 300 mils.
All right.
Yeah.
And this one probably close to 600 mils or so. And then, like
okay,
I
so
mentioned,
that's a pretty full bladder, 600, right?
So at this point, most of the time when we start palpating, the patient will feel the need to go, and it's going to be painful.
All right.
Yeah.
So this is abnormal.
Oh, that is...
Yeah, so it's probably close to 1 liter. So if a patient is able to fill the bladder up to 1 liter and he doesn't feel it, that shows that the sensation of the bladder is already impaired.
So if that person tried to go, could they?
There is a chance, let's say, for example, in someone who actually has no problems with the bladder, but he over-distends his bladder. As a result, the bladder actually goes in a state of shock and is unable to pass urine.
Okay.
So sometimes, you know, after you've gone to the toilet, you've peed, like moments later, you're like, why don't you pee again? You know that sudden urge. Is there a reason behind that? Or is it just like, I didn't pee it enough?
Yeah. So urgency is something that the bladder feels.
Yeah.
So it's possible that you have over-distended your bladder, then you're unable to completely empty the bladder at the first go, and you need to go again. But if it keeps happening, then it shows something is wrong. The most common cause of urgency will be things like a urinary tract infection, like a bladder infection where the bladder is really sensitive.
So speaking of which, you ladies actually did a little something before coming here. It's called a bladder diary, right? We've got Siti's results up first. Let's take a look. And doctor, we need your help here. Let's take a look at what went down in 24 hours.
The estimation is that the intake that Siti had was close to 3.5 liters of water.
Wow.
Or
that's
fluids, rather. Yeah. And then the output was only 1,430 mils. So sometimes we find that the urine output may be a bit low if, let's say, there's loss through sweat. Let's say if you're exercising, you lose sweat, and then, of course, your urine output will drop. The urine actually forms in the kidney and is then transported down the 2 urine tubes into the bladder. So when a patient is dehydrated, or let's say he is losing a lot of fluids through exercise, the urine that's produced by the kidney actually drops. So based on the voiding diary, total of 6 episodes of urination, based on studies, anything that's 8 times or less is considered normal.
Okay.
Yeah.
So, see, she's so relieved. She's like, fast.
Because you know what? I'm always worried that I might pee a little too much. Because for me, whenever I have the urge to go and when I can, I go.
So, Siti, you look relieved, pun intended on that one.
Of course.
So now let's take a look at Adele's chart.
Stressed.
So looking at the input and the output, her input and output is relatively balanced. She passed about close to 3 liters of urine, and she drank about 3.5 liters of fluids. All right?
Right.
The same amount of fluid.
almost.
So the maximum voided volume was 620. So she actually was able to hold her bladder beyond the usual.
That's quite a lot.
The minimum volume was about 150. So the 150 probably could have been deferred. The maximum voided interval was 3 hours, which is actually normal. But if you look in the evening, every time she drinks, she goes to the toilet to pee. If patients find that they're going to the toilet quite often, we actually do some lifestyle modification. We tell them to take sips of water instead of just gulping large
Chugging
amounts.
water.
Yeah.
Because if you chug water, the urine amount that's being formed will be larger amount, and the bladder will have to empty itself. So because of that, some patients will find that it actually affects their lifestyle.
I was wondering, like, does it absorb less into your body, or like? You know,
Actually, it
does
doesn't.
Obviously,
So-
our first thought was skin. So we're like, does it go to my skin? I must know.
That's why I do it. I drink water at night. And then I'm like, okay, this should be good for my skin, but will it make me bloat?
Yes, that was what I was going to ask. Because we were told that by right, we shouldn't drink so much right before we go to bed, right?
Yeah.
Drinking before you go to bed definitely will make you wake up. But whether it causes bloatedness, as long as there's no underlying medical issue like any heart failure or kidney failure, shouldn't be an issue. Some patients, they wake up to pee and it really affects their sleep.
Yeah.
So we'll tell them not to drink any water 2 hours before.
I wake
That's
up
so
like 3 times a
tough.
night. I
What?
do. Yeah.
From peeing or
Yeah.
other things?
No,
or,
just
okay,
peeing, yeah.
We also find that as we age, we tend to form more urine towards the nighttime.
And so for me, I'd probably have to seriously stop drinking an hour
Yes, 1 to 2
before I go
hours
to
before.
sleep. Yeah, so I'd have to leave the bar at...
You gotta work backwards. All right, it's time for a break, but when we return, we share a story of how a young woman's life turned upside down when she had to live life in the toilet for 3 months. We'll see you in a bit.
Welcome back to Let's Talk About Health. So besides talking about holding our pee, another thing we can talk about is how fast or slow we pee. And this device right here measures that.
It's got an interesting name, actually, doctor, right?
Yes.
What is it called?
We call it a uroflowmetry test. So short form, we call it Euroflow. So this device will be actually placed on the floor, and there's a transducer over here, which will then measure the flow of the urine. So the patient has to pee into the funnel, and it comes so that it hits the transducer, and then the software will be able to tell us how fast the patient has peed. So for ladies, we'll put a commode over it.
A what?
A commode.
What's
It's like
that?
a,
A toilet
it's a
seat or
toilet.
something?
Yeah.
Oh, okay. Well, we've got another one set up back there. So while you guys talk about this, I'm gonna head out and I'm gonna go for a leak.
Remember to mute your mic. Mike.
Right, that's a good
yeah,
point.
mute your
Thanks.
mic. If not, yeah. Okay, so maybe while he's doing that, you can tell us a little bit more. What does the speed of pee tell us?
Typically for a Euroflow machine to be able to generate a proper curve or tracing of how fast and the pattern of the flow, the patient needs to pass at least 150 mils. And then we will be able to tell from the shape whether it's due to some form of obstruction. The other cause of a slow flow could be due to the bladder function itself.
Guys,
Oh, you're back. You're back.
It's a bit wet, but here.
Oh,
I'm just kidding. I'm just kidding.
yeah, no thanks.
So these are my results, and I'm very curious.
I'm curious,
to
yeah,
see
let's
what's going on
take
here.
a look.
You know what? Suddenly doing the bladder diary feels so mild.
I know,
Exactly. I didn't have to do that.
It's interesting. They do what looks like an ultrasound. What was that they were doing on my stomach?
It is an ultrasound. It's ultrasound of the bladder to measure what we call the post-void residual urine. That means the urine left over after you have completed passing.
Okay, so here's the thing. How do we read this chart?
This is what we call a uroflowmetry tracing. So the first thing we will look at will be the voided volume. That means the urine that the patient has passed. So you can see over here, Mike did quite well. He passed a volume of 342 mils. And then I will compare it to the post-void residual urine. So Mike did very well. Nothing left in the bladder. So he's able to completely empty his bladder at one go. So a ballpark figure that we use will be the voided urine that's left in the bladder should not be more than 1/3 of the volume that he has voided.
Okay.
The other thing that we look at will be the maximum flow rate. He hit about maximum flow rate of 13.6. So a normal that we want to see will be at least 10 to 15. The best that we can see will be something that's 20 or above. So at 13, it is a little bit slow, but it's not that bad. And if you look at the shape of the curve, you can see here it is a little bit blunted. So there may be some form of obstruction.
Well, there was definitely a mental obstruction going on.
Because he's like, I have to perform.
Exactly. Yeah.
for
And
the
knowing
show.
that we are all waiting for your results.
I promise you, I was in the bathroom. A little bit came out at a time in the beginning, and I was like, what is happening right now? Why can't I just go? And I realized I was nervous.
Yes. So when we find that the flow is a little bit slow, we need to find out what's the cause. Is it really due to obstruction at the bladder neck? And for men, the most common thing will be an enlarged prostate. So we will do further examination. We will check the size of the prostate of the patient. And then from there, we can move on and see whether he really requires any form of treatment.
Right, so on that note, right, I'm going to take you guys to a counter that we have here of fabulous beverages. I'm kidding.
Thanks for preparing this for us,
yeah,
Sonia.
oh, you're most welcome. So what we have in front of us, I think quite self-explanatory. Different coloured pee.
So all the way on my right here, this will be what we expect of normal colour urine. Of course, if the patient is well hydrated, this might even be clearer. But this colour looks fine. The second beaker here, you can see some bubbles there. So some patients present to us for frothy urine. What we are concerned is the patient losing protein through the urine, what we call protein urine. So if that's the case, then also the patient needs to be worked up to make sure there's no problems with the kidney function. So if you look in the center here, this is actually relatively concentrated urine. Sometimes patients who have this type of urine may even have some blood in there, which actually makes it look a bit smoky.
Oh.
And if the patient has liver disease, it will even be darker, more of a brown.
But doctor, like, this is morning pee for me. And then this is the after my nighttime hydration routine color. So is it not normal to vary?
Okay, so if it's a little bit darker in the morning, it is possible because you won't be drinking throughout the night as you sleep. So the first void may be a little bit darker. But of course, if it's persistently getting darker, that's something that you need to be concerned about.
You know what I'm very curious about? This particular one. Because I've never seen
Me
too.
pee
Grapefruit
that-
juice.
Yeah,
That's good.
cloudy.
Siti, it's good that you've never seen it.
Yeah. So doctor, please.
Yeah.
I'm very curious about that one.
Most of the time, cloudy urine will be associated with offensive smell. And it's very likely there's a urinary tract infection on board.
Oh dear,
Yes.
okay. And then what about the one next to it? This one is alarming.
Yeah, so this is most likely the cause will be blood in the urine, what we call hematuria. Gross hematuria or blood in the urine, the most common cause is urinary tract infection. It can be also due to stones, urinary tract stones when you're passing stones. As for any kind of cancer, it can also be urinary tract cancer because tumors tend to bleed. So you just need a drop of blood into the urine and the urine will just stain as red.
So it's not, you don't have to go into panic mode if it looks like that. You just go to your doctor and tell them what happened, right?
Yes, but of course, if you want to see a urologist, we're always happy to see.
Yeah, straight away, yeah. He's
Doctor,
definitely...
when you mentioned about the stones earlier, were you referring to those kind of stones? The one in the little...
Yes.
Yeah, guys, this is not the cracked black pepper for your pasta, okay? Just saying, like...
Yeah, so urinary tract stones that pass out through the urinary tract tend to be black in color because of a staining by the blood as it scrapes through the area. Of course, there are times where patients actually show us that the stones actually look golden yellow. which is also possible because they're mainly just crystals.
But because if they're so tiny, especially for women, how do you know that we're actually, can you actually feel the sensation? Because, I don't know, because we can't see, right?
Okay, passage of stone, typically you will find that there's like a blockage and then there may be pain when you're trying to pass urine, and then suddenly there's a relief of the pain because the stone has passed. That will mean that the stone probably passed from the bladder through the urethra. Okay, and because for men the urethra is much longer and the presence of the prostate makes passage of stones slightly more difficult compared to ladies where the urethra is much shorter.
Right, but what causes the production of these stones?
Okay, typically stones can either be formed within the bladder itself or in the kidney. So you just need a small crystal to form in the kidney, and you're not hydrated enough. The urine is just concentrated in the kidney and it starts forming and it grows in size. So the kidney stones sometimes may not cause any pain, but as it moves around, the patient will then present with flank pain. And then should the stone drop into the urine tube, which is the ureter that joins the bladder to the kidney, that's where they end up with ureteric colic, which is the most painful pain ever known to men.
Wow.
Yes.
Okay.
But the moment you pass it out, I'm just curious, is it done? Like once you pass it out, you're good? You don't have to go to doctor?
Okay, so the problem is you have passed a stone, it may mean that you are still harboring some stones in the system. So should you see a stone out, you should go and see a urologist because we want to make sure that there are no other stones hiding in the kidney or in the ureter or even the bladder.
Well, I have seen the Stones in concert at the Hollywood Bowl. That was a different story, though. Hey, guys, coming up, we have a story of a young woman who had to live in the bathroom for months because of a bladder condition. Find out what happened to her right after the break.
Welcome back to Let's Talk About Health. And now the story of a young woman and how her life turned upside down when she was diagnosed with an overactive bladder. Let's take a look.
I've lived in the toilet for about 2 or 3 months. And it's there that I have my online classes. At night, I also sleep on the toilet. Hi everyone, I'm Yan Jiao, and I'm currently a university student.
Just like any 20-year-old who enjoys shopping and the outdoors, Yin Chia would have never imagined that her life would forever change on Christmas Eve morning 2019.
That morning, I suddenly found myself having to go to the restroom frequently, like every 10 to 20 minutes. I think that day alone, I went to the toilet about 50 times. Sometimes I'm so tired, I would just lie on my bed to rest, but I can't sleep because I have to keep getting up to use the toilet. I've even tried holding it in, but the urine would just leak out on its own and I'll wet my bed.
Because of the COVID-19 lockdown, Yin Chia was able to attend her lectures uninterrupted. However, her condition still posed a serious problem.
Imagine attending an online class and having to go back and forth between your desk and the toilet. I did that so many times to the point where I couldn't even pay attention in class at all. Eventually, I realized how troublesome it was to keep going to the toilet continuously, so I decided, why not I just sit on the toilet itself? There was one that was quite embarrassing. I was having an online class when the teacher suddenly told us to turn on our cameras. I had to dash out of the toilet to my bedroom and turn on my camera just so that the teacher could see my face.
As the lockdown measures eased, Yin Chiao started wearing diapers when she had to leave the house. But getting a good night's sleep remained problematic.
Sleeping on the toilet and waking up with body ache the next day was just something that I had to deal with. I just couldn't think of any other way to solve my problem. At that time, I was afraid to go out. I felt very isolated, and I was also very helpless and lonely.
So when I first met Yan Jiao, I was very surprised to see that she was suffering so badly with her bladder symptoms for so long, because she looks like a perfectly normal, healthy young person from the outside, and also bladder issues like urinary incontinence and overactive bladder tends to affect an older person.
Yin Chiao was given oral medication to treat her severe overactive bladder. However, when she had an adverse reaction to the medication, she was given botulinum toxin injections instead to help her bladder muscles relax.
After the first jab, my condition actually improved, but unfortunately, after a month or so, it all came back again. So I went back to Dr. Trisha again, and that's when she recommended that I do the PTNS treatment.
So we started nerve stimulation for her. It's called percutaneous tibial nerve stimulation. We place a small little needle on the inner aspect of the ankle. We think that stimulating peripheral nerves such as the tibial nerve can result in a modulation of the nerves and restore normal bladder reflexes.
After trying this treatment for about 1 to 2 months, I started to notice a significant improvement in my condition. Now, I only need to visit the restroom once every 2 to 3 hours. I definitely feel more confident going out. I no longer have to wear diapers, and I don't even have to sleep on the toilet anymore. I feel that being diagnosed with oversensitive bladder has actually helped me become a stronger person. Now I want to use my social media to share my experiences, and I hope that this will encourage those who are going through the same thing that I did to get treatment, because this condition can be treated.
Wow, you know what? She's incredibly brave to share her story like this, right?
It's shocking, right?
Yeah, after watching that, I'm no longer complaining about having to wake up at 2 or 3 a.m. in the morning to go for my one-time pee in the middle of the night.
Yeah. I mean, so, doctor, here's the thing. You know, she said that it happened just one day. She just got up, woke up, did her thing, and she suddenly had an overactive bladder. How is that possible?
Yeah.
Sometimes we can't explain how come the overactive bladder comes on just like that. Of course, we do see it in association with some patients with enlarged prostate. For some men, other than the obstructive flow, they also have an overactive bladder as a result of the obstruction.
Is that a bladder issue, or does it start with the kidneys, or is it more the bladder having the issue?
Overactive bladder would actually point to the fact that it's within the bladder itself.
Okay.
So, of course, before we diagnose the patient as having overactive bladder, we always rule out things like infections, stone disease, and of course, most importantly, make sure there's no bladder tumors.
Right, but is it preventable, though, a condition like this?
It's probably treatable. I don't think you can really prevent overactive bladder if it happens to you.
Does doing Kegels and stuff like that help with your bladder health?
Are there any exercises? Is the bladder muscle?
I'm just curious.
Work out?
So for the Kegels exercises, what you're doing is actually what I call a pelvic floor exercise. So the pelvic floor will help to maintain continence. Basically, the Kegel exercise, you have to be able to identify the muscle that you will use to stop a urinary flow. When you're passing urine. That's the muscle.
Then a Kegel, if I'm getting this right, is when you cut off the flow, that would be a Kegel.
That's the
That
muscle.
sensation,
Yes.
okay. So when you go like, whoop, that's it.
Yeah.
That's it right there.
A lot of patients have the misconception that they have to do the Kegels exercises when they're trying to pass urine. That's a definitely no-no, because that actually messes up the system.
The flow.
But it's quite amazing because talking about all these, I really need to go to the toilet.
No, it's true. It kind of gets in your psyche and you need to go.
Exactly.
Well, Adele, Siti, thank you so much for joining us. You guys have been wonderful. Thank you for,
Thanks for having us.
Thank
your
you for having
tests
us.
and going through all that at home. And Doctor, we really appreciate you being here and giving us all this incredible information.
Yeah.
That's all the time we have for tonight. Thank you so much to all our guests and Doctor. And we're going to see you guys next time on Let's Talk About Health. Hey guys, if you enjoyed this episode, make sure to check out We Need to Talk About This on our digital platforms.
Early warning signs of a prostate enlargement are if you start to wake up at night frequently. The prostate gets bigger as the man grows older, something that you cannot avoid.
But it could also lead to something like prostate cancer, right?